telephone town hall on the COVID-19 pandemic. My name is Austin, and I'm going to be your moderator for the evening. If you have a question you would like to ask, please dial *3 at any point during the call, and you will be added to the queue. Now, before we start the Q&A portion of the call, I'm going to hand it over to Congressman Scott for some opening remarks.
Thank you very much, and thank you very much, Austin, and thank everyone for joining us this evening for another town hall on the COVID-19 pandemic. Joining me this evening to help answer your questions is Dr. Jordan Asher, a physician at Centura Healthcare, Carl Knobloch from the Small Business Administration, and Bill Walton and Valerie Braxton Williams from the Virginia Employment Commission. Before I turn it over to them for brief remarks, I'd first like to discuss recent legislation that Congress passed to address the effects of the pandemic on families, workers, and small businesses. If you have a question, you can dial *9 at any point, and you'll be added to the list of people asking questions. Back on March 4th, Congress passed and President Trump signed into law an emergency $8.3 billion spending package to fund our initial response to the coronavirus, including funds for vaccine development. Then on March 13th, Congress passed the Families First Coronavirus Response Act, and then on March 27th, we passed the spread of COVID-19 will present increasingly severe challenges for students, workers, businesses, and families across the country, and these legislative packages will help ensure that we're prepared for the months ahead. The Families First response ensures universal access to no-cost COVID-19 testing by requiring all health insurance plans to cover the full cost of the tests for all U.S. consumers. It also prevents children from going hungry during the public health crisis by providing food assistance for students who would otherwise have received meals at school. This legislation has also expanded access to paid leave, and during this public health crisis, we must ensure that workers are not forced to choose between their paycheck and their health and the health of others. This is a critical step towards protecting families' financial security and mitigating the aid of the virus. The CARES Act was enacted about 10 days ago, was the latest legislative package. It focused on further mitigating the economic impact of the pandemic through direct economic relief, including direct cash payments to Americans, expanded unemployment benefits, assistance to states and localities, and relief for small businesses. The direct response includes a rebate to individuals who will receive a rebate payment of $1,200 for each adult and $500 for each dependent child under the age of 17. The advance payment for the rebates is phased out for incomes over $75,000. IRS has said that the rebate payments will start going out next week by way of direct deposit. For those who have filed their taxes and received a refund by direct deposit, they will be the first to receive their checks. Then those without direct deposit information will get paper checks, and originally the IRS said they'd be sending out about 5 million a week, but unfortunately that would take several months, and we're trying to get them to speed up the process. One thing they have acknowledged, though, that they will send them out in reverse order of income, where the lowest income individuals will get their checks first. For more information, and it's changing every day, you can go on the website www.irs, that's Internal Revenue Service, irs.gov, G-O-V, coronavirus, and that's the website, www.irs.gov/coronavirus. The CARES Act will also include an emergency expansion of unemployment insurance through the federal pandemic unemployment compensation to supplement state unemployment benefits with a flat $600 a week to fully replace wages for the median workers. For more information, you can visit the Virginia Employment Commission website. That's vec.virginia.gov. Again, Bill Walton and Valerie Braxton Williams from the VEC are on the call, and we'll go into more detail about these benefits shortly. We also included significant relief for small business owners. There's a Paycheck Protection Program, which provides $350 billion towards the retention and other certain expenses, job retention and other certain expenses for small businesses. Mr. Knobloch will talk about this and other loan programs which will be made available. Again, if you have a question, hit star 3 and you'll be added to the list of people asking questions. There are many loan programs, but the most popular one will probably be the $10,000 advance payment that may not need to be repaid, and that has to be spent mostly on payroll but other expenses. And if you have more information, you can go on the Small Business Administration website, www.sba.gov, and click on the coronavirus relief package on the first page. We know that small businesses and families are feeling the effects of the pandemic, and we hope the CARES Act will help ease that burden. We know that Governor Northam has taken a number of steps to respond to the spread of COVID-19. Most importantly, his stay-at-home order, which remains in effect until June 10th. This means that no one should leave home unless it's for essential work, food, medical reasons, or just some fresh air or exercise while maintaining social distancing. Grocery stores, pharmacies, and other essential services such as police, fire, trash removal, and so forth will remain open. We want to follow the Center for Disease Control guidelines, and if you are outside, wear a mask. It doesn't protect you particularly from the virus, but if you happen to be infected, a lot of people are infected but don't know it because there are no symptoms, it helps prevent the spread, stops you from touching your face. And another thing it does is it reminds everybody how serious the situation is. If we take it seriously, we may have a profound effect on reducing the incidence of spreading the virus, and certainly a profound effect on reducing death. On a quick note, we're spending more time at home. I want to remind people to complete the census form if you haven't already done so. It can be filled out quickly and easily. If you go to 2020 census, all one word, .gov, and complete the census. It's critically important. Over the last decade, lawmakers, business owners, and many others use the census to make critical decisions. In fact, the money that we're getting from these various bills we passed is based to a large extent on the census forms, and people that didn't fill out the forms are costing their neighbors money. We need to make sure that everybody fills out the forms so that we'll get all of what we are entitled to. Finally, I want to thank all the healthcare workers, first responders, grocery store workers, and everyone else on the front lines fighting the pandemic and ensuring that the rest of us have access to essential services. And now I'd like to introduce the experts who are joining me on the call. And first, Dr. Jordan Asher, who is a physician and chief physician executive at Centera Healthcare. Dr. Asher, do you have some remarks to make?
Sure. Thank you so much, Congressman Scott. First of all, I am humbled and honored to be on the call tonight. And I would like to thank everyone on this call for all the hard work and effort that everyone is doing that is beginning to make a difference, which I will comment here on in a few seconds. But before I do that, I'd also like to thank all of you that have healthcare providers, nurses, anyone that's dealing in the healthcare. I want to thank you because it is, as Congressman Scott mentioned, this has been very difficult on the healthcare system, and it has touched not only them but their families. At Centera Healthcare, we are very focused on two things. First of all, how do we keep our staff safe? We want to be able to provide care to anyone that needs it, and first and foremost in our mind is how do we keep our staff safe? And then secondly, how do we provide the best care not only to those we serve as patients, but also to the community as a whole? And we are very focused on not only dealing with the impact of the COVID-19 virus itself, but also the impact it is having on the communities with food and other social determinants of health. And I do want to give a quick update on something that Congressman Scott mentioned. We are definitely seeing a positive impact on the social distancing and the masking that is going on. Over the past week, we have seen the benefits that were put into place by the governor 2.5, 3 weeks ago now. And I really want to commend everybody for really stepping up and doing what was asked of us. To another point that Congressman Scott made around the masking and the importance of that and the social distancing, I do want to comment on the importance of both at the same time. We have to be careful that when we begin to mask when we go out, that we don't forget about the social distancing. Because yes, it is protecting you from spreading it, but with the social distancing, we're not shaking hands, we're not touching things that other people have touched, and these really work well together. One is not in replacement of the other. And I will be here for any questions that of any medical nature. And once again, thank you, Congressman Scott.
Thank you very much. We'll now be joined by Carl Knobloch, who is an official at the Small Business Administration. Carl, can you describe some of the plans, some of the programs that are available to small businesses?
Thank you, Congressman Scott, for having me on this call. Truly appreciate it. The first thing I want to do is I want to thank the small businesses who have suffered immensely through the challenges that they've faced through this whole process, but also their very positive attitude trying to find solutions to keep their business moving forward. And one of those solutions is some of the programs that are being offered out there that Congress put through. So one thing I want to do is try to break it out into different groups. The first thing that came out by Congress trying to take quick action was using a Small Business Administration Economic Injury Disaster Loan that's been used for years for hurricanes, earthquakes, fires, wildfires, and things like that. That was the only tool available at that time. Congress was quick to act to include virus for the first time, which made it available to the public at that point in time in small businesses. This is a loan for paying bills and payroll, and this is a 3.75% interest loan, up to 30 years to pay back. You can get up to $2 million, and you have a 1-year deferment before you have to make the first payment. Shortly thereafter, Congress came out with the big package, and with that, there came economic injury disaster loan once again, but this is the $10,000 that Congressman was talking about earlier. This is tied to SBA disaster again, and you can get the $10,000 as long as you follow the guidelines. The loan will be forgiven, and once again, that's paying for bills or payroll. So that's readily available. It's a short form. Takes about 20 minutes to fill out. With that, then came out the new plan that's just come out recently. And before I proceed to that, I want everybody to understand the first two I talked about are all Small Business Administration Disaster Division. So that's where all the economic injury disaster loans and $10,000 focus. Now we're crossing over into the other program, the payroll protection plan. And this one is a 8-week program that's really focused on trying to keep the employees whole, and so it's focused on the payroll. And it's 8 weeks that can be forgiven, and it's focusing on the payroll. And when we talk about payroll, we're talking about their salary plus all the benefits. So if you have commissions, bonuses, everything like that, that's part of that package. The other thing is with this is if 75% of the loan that you get can be used to payroll or greater, 25% or less can be used to pay utilities, rent, or lease through this process for these 2 months. And at the end, you request the loan to be forgiven, and you just have to show the proper documentation at the end, and the loan will proceed forward with being forgiven. This program is being totally done by the lenders, and that's SBA lenders and also Treasury-approved lenders, FDIC. We're also working with non-traditional lenders through this process to maximize the opportunities to get to the right businesses at this point in time. So that's kind of a high-level overview of the program. Thank you, Congressman.
Well, thank you very much. And we're joined by Bill Walton and Valerie Braxton Williams from the Virginia Employment Commission, who will describe more in detail the unemployment compensation process. Bill and Valerie?
Valerie, are you on the line?
Just unmute.
Can you hear me,
This is
Congressman?
Valerie. Hello.
Okay.
Hello.
Okay,
this is
Valerie and Bill? Okay.
This is Valerie. Can you hear me?
I can hear you, and so go ahead. Tell us what we need to know about the unemployment compensation process.
Okay, I'm Valerie Braxton Williams, and I'm the Legislative and Policy Director at the VEC. I have been on weekly calls, daily calls with the governor's office to keep them abreast of everything that's going on with the CARES Act in regard to unemployment compensation. There are several provisions for unemployment in the bill. Virginia is focusing on three because one of the unemployment programs we do not administer. There's pandemic unemployment assistance that is available for up to 39 weeks. People who are not covered under regular state UI benefits would be covered under pandemic unemployment assistance. This includes self-employed, freelancers, gig workers such as Uber and Lyft, 1099 filers, people who can demonstrate that they've worked for 18 months but they do not have enough monetary wages in their monetary base period to qualify for regular UI. It also includes farm owners and people who have a limited work history, but they can show that they had an attachment to the workforce. Again, that will be up to 39 weeks, and Bill Walton is going to talk about the process that we have to go through at VEC in order to be able to offer this benefit. One of the other benefits that Congressman Scott mentioned is called Pandemic Federal Unemployment Compensation. That is a $600 supplement that will be included with the UI payments for regular UI claimants and also people who qualify under the Pandemic Unemployment Assistance. The effective dates are from March 29th of this year until July 25th, 2020. People can expect to get that additional $600 supplement. And the last one, we're still waiting on guidance from the United States Department of Labor, is called the Pandemic Emergency Unemployment Compensation, and that will provide 13 additional weeks of benefits for claimants who have exhausted their benefits and for existing claimants as well. So those are the three unemployment benefit programs that the VEC is about to institute as soon as we can finish modifying our IT system to be able to offer these benefits.
Thank you, Valerie. Bill, you want to follow up?
Yes, sir. I'll just real briefly, because I know we want to leave time for as many questions as possible. So basically, the unemployment insurance system is designed currently to administer benefits to those working in covered employment. And now the new programs will allow folks to draw benefits where they are not typically covered. And Valerie did a good job of covering the PUA program, so we won't go into detail about that. But I will say this. In order to access the unemployment insurance program in Virginia, I would encourage folks to file their claims through www.bec.virginiaspelledout.gov, same address that you gave earlier, Congressman. And that is what starts the process. And whether you end up in the regular traditional unemployment insurance program, or if you're not eligible there, then we have to then consider you for the pandemic unemployment assistance program. That is the initial way to enter the program. And then either case, whether it's traditional or the pandemic unemployment insurance, as Valerie alluded to, both have a provision that will provide for the $600 federal pandemic unemployment compensation per week. So that's very brief on top of what Valerie said, but I wanted to leave time for questions, so I'll stop there.
Well, thank you very much. And Again, if you have questions, hit *3 and you'll be added to the list of questions. Austin, what's the first question?
Yes. We are going to move to Mark from Newport News. Mark, you are on with Congressman Scott.
Congressman Scott, how you doing?
Fine, thank you. How are you?
I'm doing fine, hanging in there. So far, I've been fortunate enough not to catch this thing yet, and I hope I can maintain that record.
Well, stay at home.
Right, you got it. I'm not. I tell you, won't get any argument out of me. Hey, let me. Okay, I saw recently on one of those White House briefings where Dr. Anthony Fauci was saying something to the effect that this coronavirus pandemic, or AKA trend, whatever, that it could end up rearing its ugly head again late this fall or early again next winter. And what I'm getting at is, does that mean that this country is going to have to go through another economic shutdown, the likes of what we're experiencing now?
Let me get Dr. Asher to talk about the medical aspects of that. That's why
Sure.
we have a doctor on the phone. Dr. Asher?
Sure. We've all heard a lot about the flattening of the curve and sort of not having a big peak. The way the virus works is that it spreads through the community. If, as we all do what we do, there is still some of it out in the community, we do expect it to continue, but hopefully in a much lower level form. The whole reason for trying to mitigate or lower that peak or to flatten the curve is to not overly stress the health system, as we have all sort of learned about. My guess is we will see episodes and in different places of having it still continue to have positive cases. As people build immunity and as the vaccine comes out, the hope would be we would be able to test people better, get a better handle on it quicker, and thus not have to do what we had to do right now. We also are thinking about this a lot in the fact this is just like this will be something that we will have to learn to have that goes on periodically, just like we have with the flu. I'm not comparing this to the flu at all, but we run through this with the flu every year. So we will not be surprised at all if, as you mentioned, Dr. Fauci commented on, that we see sort of waves periodically or we see it bumping up. We do not expect to see anywhere near what we are seeing right now, and I think we will have a much better grasp on how to isolate people quicker because testing will become much more available. We'll be able to test people for something called antibodies to see if you've had it and therefore you have some immunity. So I think, yes, we will see it continue and have waves come, but I think we will be in a much better situation to control it in a way that we were not able to with the first big wave.
Thank you. Austin?
Yep. Next, we're going to go to Diane from Norfolk. Diane, you're on with Congressman Scott. Diane from Norfolk, you there?
Yes.
Hi, you're on with Congressman Scott. What's your question?
Oh,
Hello.
my question is, I filed for unemployment, but I don't have my personal ID number, and without that, I cannot continue to put my claims in. How soon can I expect to get my personal ID number?
Valerie or Bill?
Yes. We have removed, can you hear me?
Yes, we can.
We have removed the requirement for your personal identification number, both in the online filing system and the automated voice response system. So on Sundays, you should just go in and file your claim, and you do not need your PIN number to do that.
Yeah. And if I can add,
That's as of Sunday coming up?
No. It's already in place.
Okay, as of last Sunday.
Bill, how long has it been in effect? Maybe
it's
2
been
weeks?
in place on the voice response system for a couple of weeks now, and the internet about a week now. But I do want to add one point to that. When you call the 800 number to file the week, if Valerie's correct, you do not need your PIN number to file the week to receive your payment. But you need to be careful and listen to the prompts carefully, because there are some options you can select to do business on your claim that will require a PIN, and that you may get blocked at that point. So just listen to the prompts carefully, and it should identify your open week, and you can claim for that week without a PIN.
All right, thank you.
Okay. Awesome.
Thank you, Diane. And next we are going to move to Jill from Norfolk. Jill, you're on with Congressman Scott. Jill from Norfolk, you there?
Maybe her phone is muted.
Yeah. Jill, you there? Norfolk? Alrighty. Gonna have to move to the next one.
Let me respond. We have what her question would have been. It said I think it suggested that she had gotten a tax refund through H&R Block, and wanted to know if that's the direct deposit information on file at the IRS, is that where her $1,200 is going to go? The IRS, we've been informed that the IRS has flagged the rapid refund direct deposits, and if it's one of the tax preparers that does a instant refund and then gets your refund deposited in their bank, they will flag that and they will not send it to that direct deposit. You want to go online with the IRS to give them your own direct deposit information so that your check can go directly to you.
Great. And next we're going to move to Ronald from Chesapeake. Ronald, you're on with Congressman Scott.
Good evening, Congressman. I want to thank you for holding this town meeting. They have been excellent. My question is, on the $10,000 advance, how many days after the application is completed? And I learned yesterday that after that has been completed, we anticipate within 14 to 21 days a case manager's phone call. And after we have the case manager's phone call, what would we anticipate as being the time of disbursement of those advance loans?
That's the $10,000 loan. Carl, do you want to respond?
Yes, sir. Thank you, Congressman. The $10,000 loan, the disbursements by the end of this week will start rolling out for the people that initially applied first. So they'll roll out as first come, first serve. So, but they will be starting at the end of this week. They'll start dispersing out to the people. It was originally described 3 days. Unfortunately, the demand was so huge the capabilities weren't there. So they're about 10 days behind schedule.
Now, Carl, how much of this is going through the SBA and how much is going through local banks?
This is all SBA that's coming out on this 10,000. So this is all rolling out from SBA's disaster division. This has nothing to do with the lenders.
Okay, and I understand that the demand is expected to be about 10 times more than you've ever processed in terms of loans, and that's one of the problems we're dealing with.
Yes, sir. Once people identified the 10,000, I can pretty much say I can count on one hand of all the people I've talked to that did not apply for the 10,000.
Okay. Thank you. Austin?
Yep. Okay. And next we are going to move to Gary from Newport News. Gary, you're on with Congressman Scott.
Hi, Congressman. How are you, sir?
Fine, thank you. How are you?
Doing well. I'm doing well.
Do you have a question?
Appreciate your time. Yes, sir. I definitely appreciate your time tonight.
Thank you.
We operate and run a medical transportation company here in Newport News, and we service the whole entire Tidewater region. Since this all started, we've been struggling with PPE gear. We've been piecing it together. We've done a pretty good job, but been really having a difficult time with these N95 masks. And these are for EMTs and EVOP drivers and our dispatchers. These guys are going in and out of these nursing homes, doctor's offices. They're going to dialysis appointments. and we're scrambling right now. My question is there anything being done at the federal level or state or local to help out with supplies? And I'm not talking about like handouts or anything. I'm just talking about getting supply lines so we can start purchasing again. I know the hospitals, they pretty much have first dibs, but just to give you an example, one of our suppliers contacted, and they were excited that they had some masks for us, and I was like, yeah, we'll purchase them. And it was one box of 20 N95s, one box of 20, and that's all they had. Just to give you an example, we need roughly about 2,000 for our crews to make sure that they're safe. And it's coming to a point that we're going to have to stop operations.
I'm aware that this is on the Fed. As a federal elected official, I've been disappointed that the federal government hadn't done much at all, and this is mostly being handled locally on the state. Dr. Asher, you want to say what's going on?
Yes, and definitely appreciate everything that you do. And obviously, your ability to transport is so important to us, and we also are struggling with the N95s. I would like you to contact me because we are trying to help companies like yours that are doing transport, and we've come up with a way to help that is coming online. So I don't want, please reach out to me, or someone on this call later can give you my email address, and I will be able to connect you to try to help.
That'd be amazing. Any kind of assistance, just information right now, because we're literally at the point of trying to engineer a solution. And it was the other day I was really frustrated with this because I was sitting there thinking I have no business doing this, but to ensure that our crews are safe, we have to do something. Absolutely. Because you are a key component.
One of the things we're trying to do is to get Occupational Safety and Health Administration, OSHA, to create an enforceable regulation explaining what people have to do to become safe. We have people who are in transparently unsafe conditions because of the lack of use of
Hello?
Hi. This is Austin, the moderator. I think we might have lost Congressman Scott. Hold on one second. Everyone, hang tight.
Yes, sir.
Once again, please try to reach out to me because we are working on this for you all as well.
So what was your name again, sir? And that was
Dr. Jordan. Dr. Jordan Asher with Centera Healthcare.
You will be getting a call from me tomorrow. So I definitely appreciate it, Dr. Asher.
All right, everyone remain on the line for 1 second. Let me see if I can get Congressman Scott back on the line. Everyone hold tight.
The Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press *3 on your telephone keypad at any time. The Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press *3 on your telephone keypad at any time. Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press star 3 on your telephone keypad at any time. The Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press star 3 on your telephone keypad at any time. The Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press star 3 on your telephone keypad at any time. The Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press star 3 on your telephone keypad at any time.
Yep.
Alrighty, apologies about that, everyone. We have the congressman back on the line. So next, I think we are going to move to Monique from Norfolk. Monique, you there?
Yes, I am. Can you hear me?
All right, you're on with Congressman Scott.
Can you hear me? Hi.
Hello, I can hear you.
Oh, okay. Wonderful. Thank you for accepting my call. My question is, an essential worker who has been diagnosed with a pre-existing condition such as leukemia who works in an environment such as a moving company or warehouse with more than 10 people, does the individual must report to work, or what option does the individual have when there is no empathy or compassion shown by the employer?
Okay, that's a multifaceted question. One is I'm going to ask Dr. Asher, but I'm also going to ask Valerie and Bill to respond, because if you voluntarily quit, there's a question of whether you're eligible for employment compensation. But Dr. Asher, you want to respond first?
Yes, and this is I know that many companies are really focused on how to protect their employees and trying to put them in a different function that would keep them out of risk and keep them working. And then there is the certain conditions where we believe that the risk outweighs the benefit, and therefore are put on some type of situation. And I know that every company is handling that a little bit differently. I would make sure that you're working with your physician or provider as it relates to having you make sure that all the paperwork is in order. But I can't comment on specifically how different employers are handling that specific situation.
And Bill and Valerie, if somebody chooses not to work because of the enhanced danger because of a pre-existing condition, how does the Virginia Employment Commission respond?
Yeah, so this is Bill. When someone is separated from employment, okay, I can't advise what they should do, but once they've taken a decision to separate employment, they have every right in the world to file a claim and should do so. If the separation was voluntary, at this point, we're not going to set a hearing and make a ruling immediately. We will allow folks to file a claim and start claiming weeks for payment. At some point, when their workload relaxes a little bit, we may have to actually adjudicate that issue. And when we go to do so, we will consider factors surrounding the separation. And if the person left voluntarily, we're looking at whether or not that was for good cause. And we would certainly consider the unusual circumstances that we're in now. I think that the person made reference to having underlying medical conditions. All those things would be factors, and ultimately rendering, if the claim is contested, whether or not she had good cause to leave, and we would adjudicate accordingly. But at the onset, the claim can be filed, and weeks can be claimed and paid for while we're in the adjudication process.
Now, the problem with the adjudication is if you lose your case, do you have to pay the money back? Yes. So if ultimately you're paid benefits and rendered disqualified for those benefits, you would be overpaid and require repaid benefits back. So we need to deal with that aspect of it, I guess legislatively or administratively, because that would be a real bad outcome. Yes, sir. Okay. So, all right.
Thank you.
Thank you, Monique. And next we are going to move to Uganda from Newport News. Uganda, you're on with Congressman Scott.
Good evening. Can you hear me?
I can hear you.
Hi, peace. Thank you for holding this call so that we can get the information that we need from a trusted messenger from like you. So it's truly appreciated. My question
let me say this first. A trusted messenger. We've got a physician and experts from SBA and the Virginia Employment Commission. If you're looking for medical information, don't listen to the politicians. Listen to the experts like Dr. Fauci, Dr. Asher, and others. And I'm sorry. Go ahead, Uganda.
Absolutely. So my question is about the May elections. How will the closures affect those? And is there a push to inform voters about absentee voting? Are there any precautions to ensure that the people who do want to vote are able to do so in a safe and healthy environment?
I haven't heard of any attempt to push back the May elections. They'll be going forward. In terms of absentee voting, you can file for an application for an absentee ballot, and that will be sent to you. Or you can pull up the application online. You'll mail that in, and they'll mail you your ballot. And so you can fill out your ballot, you can mail in. That's absentee by mail. You can also vote absentee in person. That's called early voting. You go in and fill out the application. They give you the ballot. You go ahead and vote. That is the simplest process. And if early voting should not have any long lines, people ought to be able to do it without any crowds. They're in the process now of trying to figure out how to arrange the polls so that people aren't congregated. There are no long lines. And so they're doing the best they can. There's no indication now that the May elections will not take place. We assume they will. And it's important. We've got in Newport News, we've got city council and the school board elections in Newport News. You've got other elections. Several of the cities have May elections, so we want to make sure that all of the voting registrars do everything they can to make it safe. And I'm not aware of any election that's going to be postponed at this point.
Okay, thank you.
Now there is on a federal level, we are trying to appropriate a lot of money so that there's no funny business in November. We've had governors at the last minute cancel primaries. Wisconsin, the governor canceled the primary, and the local court said, no, you can have the election anyway. So there's total confusion. But in Ohio, they actually postponed the election. I think it was the night before. We don't want that to happen in November. We want the registrar's offices to be prepared, have money to mail out applications for absentee ballots, arrange for early voting, arrange polling places, that are safe, so that elections can take place. We don't want to get there to the last minute when none of that planning has taken place and have the president decide, oh, because of the health emergency, we're not going to have an election. No, we want to make sure that we're prepared, and at least the Democrats are trying to get money into the next budget to make sure that there's money to make sure the elections take place. There was a little money, not quite enough, but a significant amount in the last bill, but we need to make sure there's more money so our local registrars will be prepared.
Great. Now I think we're going to move to an online question. James asks, are there specific things for which the Paycheck Protection Program can be used for?
Carl?
The payroll protection plan is basically designed for the payroll. That's its main function. So 75% of the funds or more have to go to payroll. That's literally not only the salary, any benefits like health, retirement, dental, vision, those type things. That's what the payroll side is. That other 25% or less that you want, it can only specifically go to utilities and for rent or lease of a location that you're at this point in time. So that's kind of where the funds have to go with that.
Now, Carl, is there a requirement that you maintain a certain level of payroll in order to get the loan converted to a grant?
Yeah, it's basically that maintaining that 75%. So 75% of the funds have to go to the payroll.
But you have to maintain a level of payroll. Do you have to have the same number of employees going forward as you had before?
The 75% is the magical mark. So if as long as they ask and for funds, because we know that there are situations that they would love to bring everybody on, but just because of the situation they're in, they can only get part of the team to come back on in the time frame just because of dynamic. And so as long as 75% is the magical mark, if that can be met, then it will be forgiven.
Okay. Thank you.
Mm-hmm.
Next, we're going to move to Bonita from Petersburg. Bonita, you're on with Congressman Scott.
How are you doing, Mr. Congressman?
Thank you. How are you?
I'm good. I'm glad to have an opportunity to speak with you. I have a couple of questions. My first question is about this disaster loan assistance. I actually filled out one, and there was like several questions at the end of it, and one of the questions pertains to whether you have ever had a criminal charge or been on probation or anything, and I had to answer that as yes. However, those those charges and things is over 10 years old, and I've had my rights restored and everything. So my question is, will that play a factor in whether I would be qualified to receive my loan for my sole proprietorship business?
Carl?
The number is 7 years.
Okay, it's well over 7. But yes, I did. So I know they're going to check that. So yeah. Okay. And my second question.
Wait, hold on a minute. And Carl, if you've had your rights restored, will that absolve you of all of the problems checking that box?
We always tell people to check it because it's easier to document afterwards, because sometimes what happens, if it shows up someplace as they do a check, then it kicks it out immediately. So I always tell people to do it and just write in the comment section that all rights were resolved. That pushes it through much easier than if you say no.
Okay, and if you're right, does a criminal conviction prevent you, if a recent criminal conviction prevent you from getting the loan?
A recent one, depending on the severity of it, could potentially eliminate you from it.
Okay, thank you. Bonita, do you have another question? Guess not. Okay. Austin?
All right. Next, we are going to move to another online question. Ray online would like to know, what is the SBA doing to help gig workers in freelance or freelancers? Most of us have filed for grants but have been denied or didn't hear anything back at all.
Carl, do you have? Now I'm not sure what he did. You say what he applied for?
It did not. This was an online question submitted. So.
Okay. Well, there are two parts of the question. One, I guess, from a business perspective, is he entitled to one of the loans, and whether or not paying himself would constitute the 75% going to employment?
Basically, whether it's a gig or self-employed or independent contractor, they can apply for all the programs and meet the criteria, whether it's the 10,000, whether it's the payroll protection, or unemployment. The thing is that I tell everyone, it's all about numbers. You sit here and you put each scenario into play. You look what the numbers work out to be, and the one that gives you the best, as I call, cash flow, that's the one you pursue, or a combination, because you can use the economic injury disaster loan plus the payroll protection plan together. It just can't use funds for the same purpose. And there's not been a so-called denial or have not heard. Yes, we have failed miserably on that part of communicating, and it's just because the system was overwhelmed. But if you filed for the 10,000, depending on what date you filed, by the end of this week, that money is starting to roll out into people's accounts. So, as I tell people, based on that figure, 10 to 14 days from the time you did the initial apply, if you don't have something in your account, at that point, I would be raising issue with it to identify what the problem was.
Thank you. And Bill and Valerie, for a gig worker who's unable to work, what's the process that they go through?
Yeah, so a gig economy worker who is unemployed as a result of the coronavirus crisis should file a claim for unemployment insurance through www.bec.virginia.gov. Now, this will be an application for the regular state program, which will be denied, but it is the first step to being considered for the new program, the Pandemic Unemployment Assistance Program, which is being developed or is in place to cover non-traditionally covered type of workers like your gig economy folks. And in that case, there will be a baseline of benefit established, and then on top of that, that person would be eligible for the federal pandemic unemployment compensation of $600 per week.
One of the requirements of the pandemic unemployment assistance is that the state has to establish the fact that the person is not covered under the regular state UI program.
Okay. And this is the first time we've covered gig workers, so this is the process. Just work with them, and the Employment Commission, be nice to them, because they're handling about 10 times more claims than they've ever handled before, maybe even more than that. I know the height of the 08-09 recession, nationally there were about 600,000 claims. That was the worst, 600 and some thousand claims. That was the worst week they had. Last week was 6 million, 1 week. So they're overwhelmed. So they're doing the best they can, and actually doing a pretty good job under the circumstances. So say hi to them, be nice to them. They're working as hard as they can, and the checks are getting out. Austin?
Yep. Next, we're going to move to Wanda from Newport News. Wanda, you're on with Congressman Scott.
Thank you very much, Congressman Scott, for holding this forum. I am an African-American woman, and I heard on the news today that the Surgeon General say African-Americans are more susceptible to this disease and dying from it. This disease is all over the world. Why in America is this happening in 2020? I read a study years ago where Hampton University did a study where if a white man go to the hospital and a black woman go to the hospital, both have heart attacks, the white man would receive superior service, and then likely the black woman would die. This is not successful in today's. This is 2020, and I don't understand why this is happening. Could you give me
Dr.
any
Asher?
insight on this?
Sure. Yeah.
And then can you respond? And also Dr. Asher, can you respond to the studies that have shown that implicit bias is a factor in healthcare that we need to deal with?
Sure. Health inequities or health disparities is a huge issue in this country, and it is something that we definitely need to work on and try to improve. Congressman Scott talked about something called implicit bias, where there is an underlying bias that people do not even know. And your example is fairly consistent with that, with two of the exact same people show up, depending on who they see, even though they might not think they're biased, they have implicit biases that are just built in. We are looking at this for our areas to make sure that is not happening. We even looked at it around screening and testing when we had open screening and testing, and wanted to make sure that those that were tested when we had that availability was looking like the population in the area that is being tested, which was occurring. I can't tell you what the data looks like in this area because we are just beginning to see enough cases to look at it, and we focus on this all the time. But I could not agree with you more that in this day of 2020 that health inequities still exist, and it is a personal fight of mine as well. To answer the second part of that, it is too early to know if there is a susceptibility difference from a pure medical standpoint. The data does show that for some reason that it does impact males greater than females, and it's just too early to understand why it impacts some versus another. Same thing with age. We see with other viruses, it in fact impacts children more than adults. For instance, influenza. We're not seeing that with coronavirus. So we do not have an explanation for the physiologic or the medical difference. However, the question of implicit bias and other biases is real and is something we should all focus on every day.
And Dr. Asher, is medical education dealing with that issue?
Medical education, ongoing education, role playing. We focus a lot on it as when we bring new employees on board with present staff. It is definitely an area of focus that many, if not all, should be working on, and even just identifying if there is an implicit bias. And just to make matters even more difficult, a lot of the medical science that has been done over many years have biases built into the data. So we don't even know that one type of group should be treated differently because it was not studied that way. And so this is definitely a historical problem in lots of areas, including the medical field.
Thank you, Dr. Asher. Thank you.
And next we have a question from Facebook. Joanne says, I'm self-employed and my unemployment was denied. Is there something else I need to do?
Yeah, so this is Bill again.
Excuse me?
Yeah, this is Bill. So it sounds like this person has filed a claim, and what they did is they filed for the regular state unemployment insurance claim, and because they're self-employed, their wages aren't reported to us, and the claim is invalid under the state claim. It sounds like this person is exactly who PUA, Pandemic Unemployment Assistance, was designed for. We will be pushing out information over the next few days as we stand up this new program on what steps that person will need to take to further their application so that benefits can be paid under the PUA program.
Okay, great. Next, we are going to move to Noah from Hampton. Noah, you're on with Congressman Scott.
Yes, good afternoon. Congressman Scott, thank you, and Governor North, the Governor of Virginia, Congressman Laurie, for your hard and great work for the Virginians and the state. I believe we must fight this virus on all fronts by following the Governor of Virginia guidelines. My question is, have anyone spoken to the Governor of Virginia about closing down the Newport News shipyard and the Norfolk Naval shipyard? Because those people in those shipyards need to be segregated by testing to stop the spread of the virus. We must fight this on all fronts because those people, it's thousands, we're talking about thousands of people in Newport News shipyard and Norfolk shipyard, Portsmouth shipyard over there, and they're going home each and every day without being tested, some probably positive, spreading the virus to their family members. I thank God for the Governor of Virginia, his guidelines, which has been great to stop the virus, because the president, he come on the news, the national news, and the local pick it up, spitting out propaganda, and the news media is not fact-checking it, confusing the people and all. But my question, have anybody spoken to the governor about closing down these shipyards so we can fight this virus on all fronts? Those people working in clusters over there, and they don't have face masks or anything to put on. So I think this would help out the state to, today, the cases went up to 455 cases in one day. And I think this would help out. Have anyone spoken to the governor about shutting down these shipyards?
There are ongoing discussions at all levels of government about the shipyards. Closing down the shipyards would be a national security issue because all of the shipyards deal with Navy ships. But all of the work done in Norfolk Naval and the Newport News, close to 100%, is national security, military construction and repair. The shipyards are aware of the problem. They're doing what they can to separate the people the best they can. But I can assure you that there are ongoing discussions as to how long they should stay open. At this point, they're open, but for the reasons you have cited, there's ongoing discussion as to what to do and whether that's appropriate.
All right. Thank you very much. And next, we are going to move to James Parker. You had a question about the Social Security Administration. James, you're on with Congressman Scott.
Yes. Hi, Congressman Scott. Thank you for having this, and I hope you're doing well.
Thank you.
There was one thing about Social Security. You may have already went over this before. The stimulus checks. Will they also go out for the people by Social Security that are getting Social Security? Will they be sending the stimulus checks out?
Every adult is supposed to get one. The Internal Revenue Service is in charge of sending out the checks, so everybody who has filed taxes will be on their list. They are coordinating their list with the Social Security Administration because a lot of people on Social Security do not file taxes. There's also railroad retirement. They're going to get that list. Those on SSI, disability, and veterans disability, we're trying to see if those lists could be coordinated with Internal Revenue Service so they could get checks. People who have not filed, if you go on the internalrevenue.gov website, it's irs.gov. They will have information, and it changes every day. They're not totally caught up, but there will be an opportunity for people to fill out an online form to give information about who you are and where you live, so that you can get your $1,200. That's not available now, but Social Security recipients specifically have been taken care of. So they will be on the list, and they'll be getting their checks. If you get your check by direct deposit, they'll be deposited in your checking account.
Well, thank you. I have two compliments I wanted to give real quick. I appreciate that you having this, and plus I appreciate you answering my question, because I do get SSDI, and I have to pay taxes every year. So they don't have my checking account information, but my Social Security SSDI is automatically deposited into my checking account, and they do have it.
Check with the Internal Revenue website, and it changes every day, so you got to check every day. There should be an opportunity for you to fill out your information so that you can get your check filed directly by direct deposit. But right now, the way it stands, those on disability, unless they have, if you file taxes, you ought to be on the list already, so you shouldn't have any problem. And if you get, if you file taxes and got your refund or whatever by direct deposit, you ought to be okay. If you file taxes, if you have not filed taxes, then you have to go on the Internal Revenue website and wait for them to publish a website form, and then you can fill out the form and tell them where to send the check.
Great. And unfortunately, we only have time for two more questions, so we're going to move quickly to Ellen from Newport News. Ellen, you're on with Congressman Scott.
Thank you all for allowing me to ask this question. Now, I got laid off from a company, March the 6th, and I filed my unemployment, and I got approved. I got my money, and I got my check today. But somehow, when will the $600 started coming in from the federal government, and will they go back to pay me those weeks that I didn't receive it?
Yeah. So this is Bill. You're referring to the federal pandemic unemployment compensation, and that's the $600 that will apply to regular unemployment, which is what it sounds like you're receiving.
Yeah.
And will also apply to the pandemic unemployment assistance recipients. And then, of course, the third category that I won't cover right now, but you're receiving the regular unemployment insurance. You got your first payment to this last week or this week?
I got 3 checks. I got 2 last week, and I got my one today.
Okay. So the federal pandemic unemployment compensation, that's the extra $600. The first week in which that money is payable is for the week ending April the 4th. That's the week we just ended. Okay, your check that you received for that week, or your payment, I should say, only covered the base UI amount. That additional $600 will be paid to you in any additional week that you claim and are going forward. And we should have that up and payable to you by the end of next week. Okay. And then it will be timely every week when you claim your regular week, your regular payment in addition to the $600 will be issued in one payment. But we're still programming.
Now, Bill, she's eligible for this week, but you're saying you won't be up and running till next week. Next week, when she gets paid, will she be paid for both weeks? The $600.
Yes, sir. Once the programming is complete, to add the $600, and such as her case, it will be automatic. When she claims the week, she'll get her regular payment and the additional $600 at the same time. And when the programming is in place, we will also do a look through and pay retroactively any benefits that should have been paid beginning with this most recent week that has just passed going forward.
This is Valerie. One of the delays is that every state had to fill out what was called a supplemental budget request in order to draw down the federal funds that are needed to pay these benefits. So the USDOL is still in the process of looking at those supplemental budget requests to make sure every state meets all the requirements to receive the federal drawdown to be able to pay the benefits, because these benefits will not come out of the regular state UI trust fund. they will be totally federally supplemented. So that is another delay.
Yeah, and what Valerie said is true, but all indicators are that those things are falling into place. Programmers are working on it, and we expect everything to be ready and start making payments next week, and then every week thereafter in the duration of the program.
Oh, great. Thank you.
Thank you.
Thank you, Ellen. And the last question we're going to do comes from online, and Renee asks online, what steps have been taken to improve the ability to submit unemployment claims? I can't get through on the phone. I need help.
Okay, so this is Bill again. So we have expanded our capacity in the call centers. We are adding additional support in our call centers to take claims. We are reallocating human resources within the UI Unemployment Insurance Division to help and aid our benefits staff in processing the tremendous amount of work that we have. So we're reallocating resources. We're expanding services in our call centers and looking at other creative ways to process the work as quickly as we can. Valerie, do you have anything to add to that, ma'am?
Just the online system may be the best route to go, but keep in mind, because of the influx of online claims, the system was not even designed to accommodate the number of claims we are receiving. So our vendor for that is constantly looking at adding capacity to that as well as the claim volume increases.
All right, and that was our last question. So, Congressman Scott, you have closing remarks?
Well, thank you very much. I want to thank everybody for participating, and particularly want to thank Dr. Asher. One of the comments was made is she appreciates the expert information. What Dr. Asher gave the expert medical, Carl Noblock from the SBA gave the real information from the SBA, and Bill Walton and Valerie Braxton Williams talked about what is actually going on in the Employment Commission. I want to thank everybody for participating. Fill out your census forms, and many of you may get a phone call from me shortly asking if you have any comments or additional questions. You can leave a message on that line. But thank you very much for participating, and we look forward to the next opportunity. Thank you.